to kick off a round of questions, and I want to begin with Dr. Marrazzo. More than a decade ago, researchers at the University of Wisconsin-Madison studying avian flu, or H5N1, warned that only a few mutations in the virus would enable it to transmit to mammals. Today, H5N1 has infected 51 dairy cattle herds across 9 states. Just yesterday, a second human case of H5N1 infection was detected in Michigan. Fortunately, as far as we know, the virus has not spread to my home state of Wisconsin, but it has caused concern for dairy farmers in my state and across the country. I recently convened a roundtable with federal and state agency leaders and dairy stakeholders in Wisconsin on the current state of the disease and strategies for mitigating its impact on human and animal health. Scientists still don't know how the virus is spreading or how long cows remain infectious, and our roughly 100,000 farm workers are at the highest risk of infection. So, Dr. Marrazzo, please tell me about NIAID's tracking of the spread of H5N1 or mutations in the virus and the work that you're doing to develop a vaccine against it.
Thank you for that question, Chair Baldwin. This is an incredibly important topic, and I do want to acknowledge the great work that our University of Wisconsin colleagues have done. In fact, they have been part of one of the networks that I want to tell you about. This is a pathogen that has been on our radar for a long time because when it does get into human hosts, we have seen a mortality of about 50%. So this is something we really do not want to happen. What we have been doing for more than 10 years is funding a group of investigators called the Centers for Excellence in Influenza Research and Response, of which your university is one. And what they do is to collect and characterize this virus in wildlife, including migratory birds, which has been, of course, a very big source of these viruses. And that's important because, as you mentioned, you do need to track the mutations that are occurring in the wild so that you can be prepared to prepare the vaccines and antivirals that you're going to need if those viruses get into human hosts. So really important network that has been doing incredible work. And that's been informing us even before this current outbreak. With regard to the current outbreak, the good news is that many of the viruses that they have been identifying are very similar, if not almost identical to the case in the humans, both humans that we know about. Although the sequencing hasn't been done on the human case we heard about yesterday, but we assume it's going to be the same one. So the good news is that we're really prepared to not only test the current vaccines that we have in the stockpile, but also to really develop specific vaccines. So I think we're in a very good place. We're also working closely with some of the other agencies that are involved in this, and continuing to develop monoclonal antibodies, vaccines, and antiviral drugs, all very much a part of our remit and very much engaged right now in doing this.
Thank you. Dr. Volkov, while recent CDC data shows a slight decrease from the prior year, overdose deaths still claimed more than 100,000 lives for the third year in a row. These deaths are largely attributable to illicit fentanyl. And a NIDA study published last week shows the availability of illicit fentanyl continues to skyrocket. 115 million illicit fentanyl pills were seized by law enforcement last year. We can and must do more to stop this epidemic and save lives. I know this is a bipartisan priority for members of this committee, including Senator Capito and myself. That's why we provided a $5 million increase for opioid research in the fiscal year 2024 Labor HHS bill. So, Dr. Volkov, 2 years ago, HHS launched a coordinated national strategy to prevent overdoses. What can you tell us about the Healing Communities study and what interventions it has found to be most effective at the local level?
Thanks very much for your question, and thanks for your interest on this very challenging issue posed by the overdose crisis. The Healing Community Study aimed to actually empower the communities in order to give them the resources and the support necessary for them to respond to the local circumstances at which they find, because we see that the overdose crisis is very heterogeneous across the nation, and we wanted to learn from this community. So the Healing Community Studies empowers them, allowing them to get the data and to develop the interventions that are more likely to be beneficial. And as a result of that, we have learned strategies that then can be deployed to other states, because this was done just in 4 states, and now actually are expanding access to data that allows the communities to see whether their interventions are making a difference or not. And in the process, we've seen a significant expanded distribution of naloxone and a significant expanded recruitment of people into medications for opioid use disorder, and an improvement in the practices for treating patients with pain properly with opioids when they need it or using alternative treatments.
Thank you. Senator Capito.